May is Older Americans Month, which celebrates the contributions of older Americans across this country. As I announced earlier this week, we're going to test every nursing home resident and every staff member in every one of our 700 long-term care facilities. This is a great undertaking, but it honors the value of these lives. We know it's a very vulnerable population, and we are committed to doing whatever it is we need to do to keep them safe. Earlier today, we released guidance for churches and other places of worship in Tennessee. As you know, we have not, throughout this effort, mandated church closures in this state, but we have recommended, and we continue to recommend, that churches not meet during this time, but we want to go ahead and put this guidance out so churches can begin the planning process. We will watch symptom, case, and hospitalization data over the next couple of weeks and provide updates to churches throughout that time. As of today, restaurants, retail, and gyms have the ability to open in limited capacity in 89 of our 95 counties. Throughout this week, we've reminded businesses to follow the detailed guidelines that we've released through the Tennessee Pledge. Today, we want to recognize Redbud Deli and Morristown for their efforts to open safely. We thank Chambers of Commerce across the state for getting the word out about the Tennessee Pledge and highlighting those businesses that are doing right by our citizens. Next week, we look forward to the safe reopening of close contact services in 89 of our 95 counties. As more Tennesseans return to work, we remind everyone that free COVID-19 testing is available at drive-through locations across the state this weekend. Please visit the Department of Health's website for more information, and remember, when in doubt, get a test. We are up to 11,891 COVID-19 cases in Tennessee, 186,000 total tests in our state. We have 1,156 new cases since yesterday. 897 of today's new positives are from Trousdale Turner Correctional Facility. 259 of our new cases are from the general population. This large number of new cases is a result of the mass testing that we've done at Trousdale Correctional Center. We've identified 1,246 cases in this facility alone. Of these cases, 22 are of staff and the rest are inmates. That amounts to about 54% of the inmates and 12% of the staff at that prison. We can report that at the moment, 2 inmates from the Trousdale Correctional Center have been hospitalized. 98% of the positive cases are asymptomatic. Earlier today, our Unified Command Group announced that we've made the decision to begin mass testing at all Tennessee state prisons. We believe that we are the first state in the country to take this action. Thanks to our increased testing capacity, we'll test all inmates and staff statewide in order to take the appropriate actions to safeguard the health of these individuals. We've been in close contact with the Tennessee Department of Correction as it began targeted COVID-19 testing of inmates and staff in early April. Given the increase in positive cases at the Bledsoe and Trousdale facilities, despite the vast majority being asymptomatic, we're going to take the next steps in partnership with Department of Correction, Department of Health, and the Tennessee National Guard to support a broader testing strategy and to promote the health and safety of staff and inmates. We'll also coordinate plans with our local jails to assist them in safeguarding the health of their population in the coming days. The positive and negative groups are separated in different housing units. All inmates who test positive and are asymptomatic receive daily medical monitoring and health assessments. Inmates who are asymptomatic will be monitored at their facilities while medical teams check daily for symptoms. Those who may become symptomatic but don't require additional care will be treated in place at local hospitals, depending on their needs. If needed, we'll use our alternate hospital facility as well as Department of Correction regional facilities, which are equipped with the appropriate medical equipment. If they're symptomatic, but only displaying symptoms such as coughing or fever, they'll remain in place and we'll manage supportive care locally. Commissioner Parker from Department of Correction and General Holmes from Department of Military are both available to answer questions during our question and answer period. Now I want to ask Department of Labor and Workforce Commissioner Jeff McCord to step up and give an update regarding the unemployment claims here in Tennessee.
Thank you, Governor. I'll give a quick update and a quick clarification. So far this week we paid over 300,000 claims to both 1099 PUA individuals as well as your traditional W-2 wages. So 300,000 claims. We also were able this past weekend to upgrade our system, and the performance has become significantly better, allowing us to work faster. Finally, we're still struggling with quite a bit of call volume, and that volume is going down and should go down once we've done the root causes of our system and also getting our PUA 1099 benefits rolling out. So that's where we are in the system, and that's where we are in claims. We continue to work that backlog, especially with our PUA who have been waiting for such a long time. Finally, the last clarification is when we entered this time period in March, we had a high level of confidence that our trust fund could weather a recession, even a very deep one. However, this is not that, and we are fully aware of the pressure on the trust fund and monitoring that daily. May 15th is when the official balance is done for the trust fund, both looking at accruals and also incoming revenues, so we can have that number after that time. Thank you, Governor.
Thanks, Dr. McCord. Commissioner Piercy, would you please step up and give our daily health report?
Thank you, Governor. Good afternoon. Again, our case count is 11,891, which is up, 11,891, which is up 1,156. That is a 10.8% total increase. I'm about to give several numbers, so I'll try to go through them slowly. As the Governor mentioned, of the 1,156 new cases, 897 were from the Trousdale prison. Of the ones that were not from the prison, that leaves 259, which brings our day-over-day increase after the prison numbers have been removed to 2.4%. That's in line with what we've been seeing in the general community, and that does not cause us concern. However, as the Governor mentioned, obviously 1,246 total cases at the Trousdale Turtle Correctional Facility do cause us concern. We have posted some of those previously. Some more will be added tomorrow. So when you're looking at that Trousdale number, take that into consideration, as well as the fact that some of the staff doesn't live in Trousdale County, and that's assigned to their county of residence. But I do want to confirm 1,246 cases at the Trousdale facility, which will be covered by Commissioner Parker. I do want to take this opportunity to tell you a little bit about our overall testing strategy, because I think you're going to start to see a shift in the month of May, and it's important to know what to expect. So we started out with sort of what I call a responsive testing strategy, which is what every lab does. You sit back and you wait, and when you get a specimen, you test it, and then you give the results. That's just responsive, just responding to the need. Then maybe a couple of weeks ago now, 2.5 weeks ago or so, we moved towards a more population-based testing strategy. And you'll remember that's when we expanded our testing criteria and we made significant advances in our testing availability. That was the time we started adding the weekend events. This weekend, starting tomorrow, will be the third weekend in a row that we've done that. While that is expanded criteria and expanded availability, that's still somewhat passive. We're there and we're available, but people have to come to us. We're getting into the part, particularly in the month of May and going forward, where we're taking a much more active strategy. We're going out and looking for people to try to find people that are positive. That doesn't mean we're going to come into your homes or do anything that you don't want us to do, but we're targeting high-risk populations. You've heard us talk earlier in the week about long-term care facilities. You heard the Governor mention today that we are making the decision to proactively test every prisoner in the state of Tennessee. we're going to have more cases because we're going to look for them. And we're doing that intentionally because it's really important. When we find cases, we can intervene earlier and have better outcomes. So I want you to keep that in mind as we move through the month of March and start increasing our targeted testing approach, that our numbers are going to go up, and that's what we want. Because just because you don't know about something doesn't mean it doesn't exist. And so we would rather know about it so we can take care of those folks appropriately. Finally, I do want to remind you that we have a total of 16 sites this weekend, 8 on Saturday, 8 on Sunday. The big pop-up mass testing drive-through facilities, those are listed on our website. I encourage you to look at that. And then don't forget, all 5 days of the week, our health departments are doing testing on a walk-in basis, so check out our website for that as well. I'll stand by for questions. Thanks.
Thank you, Dr. Piercy. General Holmes, I'd like you to come up just for a moment and talk about our pre-planning, the plans that we've been making regarding these prison outbreaks and how we plan to test in those prisons.
Yes, sir. Thank you, Governor. So as part of the Unified Command Group, Department of Military have been working with Department of Corrections for literally weeks on various scenarios, various plans. We have approximately 250 soldiers and airmen that have been training with Department of Corrections personnel in Tullahoma at our mobilization station. So we have 4 teams, basically, that are called surge teams. Each one of those teams are made up of a combination of support staff and medical professionals. Each one of these have high capacity to test large numbers of individuals in various scenarios. We've actually executed those surge teams over the past 2 weeks in a number of different scenarios. So each one can test approximately 1 to 2,000. We have 4 of those teams. And they're trained. We have a lot of data points. We've actually went into detention facilities over the past 2 weeks, so we have a lot of lessons and best practices that we can implement. And we've executed this numerous times. So we feel very confident that we can execute this mission. And one of my plans early on was to have forces available for any type of mission that we might be asked to do, and we've done just that. So this is not something that was hurriedly prepared or anything like that. This is a deliberate execution and implementation of a plan that's already been implemented in some cases. And this will have no impact on any of the testing for our long-term care facilities. So we'll conduct both of those simultaneously. And I'll be subject to anybody's questions. Thank you.
Thank you, sir. Thank you for those comments. We'll open up for questions in a minute, but I just want to remind folks that while we are, in fact, strengthening our strategy for testing and pursuing targeted populations, pursuing those that we believe may have a higher chance for being positive, and we want to know those populations. That's why we're pursuing them. It is incredibly important that our general population continue to be tested in great measure. That's why we're doing these pop-up sites. That's why you can get a free COVID test every day of the week at your local health department. That's why we need to continue to say to you, and you need to remember, when in doubt, get a test. We want to make sure that folks, symptomatic or not, across this state, pursue getting a test, particularly as more and more people are going back to work. We're very encouraged. We're grateful to those businesses that have taken the Tennessee Pledge, that are opening up in a new way, not business as usual, but in the new way, following the guidelines in the Tennessee Pledge, to provide for the safety for our people, for health outcomes for our citizens, but at the same time, giving people an opportunity to get back to work and to cracking the door open on Tennessee's economy. We're very proud of what each individual is doing in this state. Continue to do your part to stay apart. Be happy to open the lines up for questions.
Thank you, Governor. First, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hey, Governor.
Hey, Natalie.
This afternoon, CoreCivic has said that of 1,300 prisoners at Trousdale, inmates who have tested positive for coronavirus, there were just 2 of those who showed symptoms. And then, of course, the state has said that among its prisons, 98% of those who tested positive have been asymptomatic. Mm-hmm. So my question is, do you have any doubts about that statistic, that only 2 of those 1,300 showed symptoms, that only 2% of inmates are showing symptoms. And then also, what does that high asymptomatic rate mean for the outbreak outside of prison walls? So what does that mean if potentially this many people are walking around carrying the virus who aren't showing symptoms? Because that number seems a lot higher than what we've seen at other outbreaks on cruise ships and whatnot, as far as the asymptomatic.
I'm going to let Dr. Piercy answer specifically, but we've been talking about this even today as we got these Trousdale numbers, and we've done a lot of we've looked at a lot of information from other prison outbreaks across the country, and it is a phenomenon among the prison population that the vast majority of that population that test positive are in fact asymptomatic. And one of the things that we're looking for in our mass testing for our general population is that same kind of information. You know, we have done these pop-up tests and pursued asymptomatic citizens in the general population, so we can in fact determine if there are large numbers of asymptomatic folks out there. The data has not shown that to date. We've had days where we had several thousand, 7,000 and 8,000 tests with a relatively low positivity rate, nothing compared to the same kind of numbers we have in the prison population. But we're actually looking at that because we too find that interesting. Dr. Piercy, you want to comment?
Yeah, actually don't have a whole lot more to add than what the governor said, other than to emphasize the fact all of us physicians sit around and say, how is this happening? We don't understand the physiology behind why prison populations in general seem to be doing so well with this from a symptomatic standpoint. We can sort of explain why elderly people in nursing homes and those that may have compromised immune systems don't show symptoms as often or as quickly as others. But ostensibly, the prison population, while there are some increased comorbidities, their health status and their age is more reflective of those in the general population. So from a scientific standpoint, it's a real head scratcher why they have such a high asymptomatic rate. And you know, we were talking earlier today, normally when you get these kind of results, every doctor will say, if you get a result that doesn't make sense, you should probably repeat it. And in this situation, it doesn't call for repeating because this is the same experience that we've seen all across the nation. And that's what Commissioner Parker's counterparts have told him. That's what my counterparts have told me. It's going to be a fascinating scientific study to figure out what the different characteristics are of this population that make them more likely to be asymptomatic. That's a long-winded answer to say we don't know why, but we do know that the overwhelming majority of them are well. They're just testing positive. So we're going to take care of them just like we would anybody else. And if they get sicker and they need a higher level of care, we'll provide that just as we would for anyone.
Thank you, Dr. Piercy. Governor, do you think there's anything the Department of Corrections could have done to prevent this, should do moving forward? Could this outbreak have been prevented? And could you speak to whether there's any questions about discrepancies between how CoreCivic, a private prison operating company, is handling the coronavirus outbreak versus how your state-run facilities are?
Yeah, I'll actually let Dr. Piercy comment on how the different prisons or potentially Commissioner Parker could add as well. But we've had a very defined strategy that is consistent with what Department of Corrections are doing across the country. As soon as there are cases, then we test, as Dr. Piercy has talked about, a phased approach. We test a greater group to determine if there are more cases. Then we test sections of the prison. And in our case, then we've made the decision to mass test the entire prison. I don't think that typically happens across the country, but that's the decision that we made, which is the reason that we tested Bledsoe and ultimately Turner. So, and now, as a result of the high test rate, the positivity rate that we got today, we've made the decision to just test the entire prison population for the state. That same testing strategy has occurred whether it's in a CoreCivic prison or in our state prisons. And the different strategies have not been different and will continue to be the same. We will test every prisoner in both core civic prisons as well as the state prisons. Do either of you have anything to add there? Commissioner Parker?
Thank you, Governor. Just a couple of things. The Governor summed it up very well. Core civic facilities are operating under the same protocols as state facilities. Even the canceling of visitation, stopping all volunteer services early on at the end of March was the same. I can also say that my discussions with Core Civic after this testing and as we see results coming in has been that they will follow the same protocols in relation to inmate care, in relation to the daily medical assessments of the inmate population, as well as establishing the communication links for inmates to stay in touch with their family. We realize family members want to stay in touch and be kept in the loop in regards to their loved ones. We're going to make sure that happens in a core civic facility as well as in a state-run facility. And I would remind everyone, this experience that we saw at Bledsoe, we mass tested at Bledsoe, a state facility. We saw high numbers of asymptomatic inmates there in a state-run facility. I'm proud to say next week, those inmates, we're scheduled to release about 500 inmates out of isolation that have remained asymptomatic through this whole process, been monitored daily, and they will be leaving isolation next week on Tuesdays and Wednesdays. So we're confident in moving forward. I think we're taking a great approach to this by testing all of the inmates and staff across TDOC. I think we're experiencing something here in Tennessee that other states have seen. I do think the one difference with us is that we've decided to go ahead and test the entire population, which I think is very proactive. Thank you.
Thank you.
Thank you.
Next, we'll go to Adrian Saines with the Associated Press. Adrian, your line is open.
Thank you. Related to the places of worship order, the city of Memphis had issued some back-to-business guidelines restricting church buildings to hold services at only 25% capacity. Your recommendations say 50% capacity. The mayor of Memphis today said that your orders or your recommendations supersede the city's. Is that accurate? And can you tell me if you've been in discussions with the government in Memphis about these different orders?
Well, first of all, we've never mandated any requirements for churches. Churches have been essential, and we haven't mandated the closure of those churches. We are in, members of our team are in daily communication with members of the municipalities and those counties that are not under the state's Department of Health directives. So I don't know the specific differences in our guidance or our suggestions for churches relative to the Memphis guidance, but as I said before, our issuance of this guidance to churches is to help them understand what we suggest and understand what we would hope for in the next coming weeks, and that guidance may change as the data changes in the future.
Thank you.
Thank you.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Yes, Governor, the question I have is, when do you expect these tests of all of the other prisoners in the state to come in? I know they start next week, but is there a urgency in getting them done to see if there's further issues here potentially and help you learn more about this?
Yeah, Chris, just any targeted population that is as large as the prison population will take some time to do. General Holmes, I don't know if we have developed a timeline for that, but that we're developing that. We just made that determination as of today. We've had the plan in place, but the numbers drove that decision today. So the particular dates, I don't know if you have a clarity on that, General Holmes.
Yes, sir. So we know the capacity that we have, and so it's really distributing that to the facilities. We have 7 facilities that we haven't tested, so we've been into 3 already. So it'll just be the distribution of our. We got 4 teams, as I said. Each one of these teams can be divided up based on the number that we'll be testing. So it's just putting kind of the fine lines on the plans. I would say within the next week or 2. We'll definitely get started right away, but a lot of that will just be dependent on the ability to kind of arrange all that. We do things like employees, so finding the time that's optimal, to test the employees. Shift changes are optimal to do that, so you're testing incoming, outgoing shifts. So it's just really arranging the plan and picking the locations. Thank you.
And also, one quick follow-up. How does this, there's been lots of talk of reducing Tennessee's prison population. People are getting out of prison on a daily basis when they've completed their sentences. How does this affect the release of prisoners?
Commissioner Parker, you want to comment on that?
So thanks for the question, Chris. It has no effect on the release of inmates that are expiring their sentence or inmates that have made parole. One of the things we are doing is testing those inmates before we release those inmates. So that is occurring, but it has no effect on their release date or being released from the facility.
Okay, thank you very much.
Thank you.
Next, we'll go to Chris Davis with News Channel 5. Chris, your line is open.
Good afternoon. A 2017 state audit showed that core civic staffing levels at Trousdale Turner were too low. Has that improved over the last few years? Do you think understaffing could have potentially played a role in exacerbating this outbreak?
I have no reason to believe that staffing levels had anything to do with the high positive rates there at Trousdale. We have monitors in those facilities. We track compliance with staffing, both security staffing, medical staffing, and we have no reason or no evidence to support that any staffing issue whatsoever had anything to do with the positive rate at Trousdale.
Thank you.
Next, we'll go to Shannon Sharp with WTVC. Shannon, your line is open.
Governor, just last week there were 5 confirmed cases among residents and staff at Leicester Center of Athens. Now there are 97 confirmed cases. 3 residents have died and 2 more are in the hospital. How do you, this rapidly developing hotspot, I guess it raises a question about state oversight of nursing homes. How do you respond to that? And are you satisfied that the state is doing everything to protect senior citizens in state licensed facilities?
As we announced earlier this week, we have developed a strategy and have begun to implement that to test every single resident in every staff member in every long-term care facility that we have. We know that these are the most vulnerable of our population. They are the ones that we are most concerned about with regard to loss of life, and those outbreaks in the nursing homes that we've had are the very reason that we are taking these increased testing capacities that we now have access to and targeting them at that population. That's exactly what we hope to help mitigate in the weeks ahead.
And with 30% of staff testing positive, are you monitoring the care of the residents? Or are you helping them with fill-in staff?
You want to comment on our strategy with nursing homes that are positive?
So for any nursing home that has a case, they are still expected to meet all state guidelines, even regarding staffing and services provided, despite staffing challenges that they may have, and we recognize that that's a challenge. But our infection preventionists, as well as our surveyors, make sure that they are both taking care of the infection-related issues as well as all of the standard issues, which does include staffing ratios. And to my knowledge, we found no deficiencies at that facility.
Next, we'll go to Kathleen Seri from Fox 17. Kathleen, your line is open.
Thank you. Governor, if you could comment on the opening of gyms today. We know that these are businesses where a lot of people are really anxious to get back to high contact places where they're touching a lot of surfaces. Do you believe that the guidelines you issued earlier this month are strict enough to maintain healthy environments for people in these places, or are we potentially opening ourselves back up to more spread of the virus? And then I also have a second question about the proposed 32% tax hike in Nashville, and what you would say to businesses who are already going through such a stressful financial time and now may be hit with a tax hike as well.
Yeah, gyms are opening up today in a new way. And if you look at the Tennessee Pledge, it gives detailed guidelines, tools for those businesses that are opening up. It's a limited it's a changed way that they will be opening. It eliminates the use of communal areas, so spaces where people can gather. It limits like locker rooms or pools or self-serve eating stations and that sort of thing. It also gives real guidance to the number of people that can be in a facility, so that it allows for appropriate social distancing and sanitation of the equipment in between users. So there are some clear guidelines that allow a gym to open up in a new way, but open up in a way that is safe and that provides opportunity for Tennesseans to address mental, and which addresses physical needs as well. When you address physical needs, you address mental needs. So we do believe that the ways that gyms are opening up across this state will allow Tennesseans to access the use of exercise facilities, but at the same time stay safe. Regarding a tax increase, I haven't talked to Mayor Cooper about his budget or his proposed increase. Certainly, increasing taxes are a burden. There's no way around that burden. Well, there are ways around it, but there's no denying that an increase is a burden. We certainly, in the state, we are looking to try and manage our budget in a way that we do not implement tax increases across the state. Those are difficult for businesses, they're difficult for individuals, but I haven't talked to the mayor about his proposed increase.
Next, we'll go to Sarah Callahan with WVLT. Sarah, your line is open. Sarah Callahan, WVLT, your line is open. Next, we'll go to Sergio Martinez Beltran from WPLN. Sergio, your line is open.
Thank you, Gillum, and good afternoon, Governor. The records show, including a recent report from the Comptroller's Office, that CoreCivic has not shared or reported in the past enough or accurate data. So my first question is, why is it up to CoreCivic to test the inmates and staff, and how is the state making sure that CoreCivic is going to be following the protocols?
I'll let Commissioner Parker answer that.
Thank you. It's important to remember that at every CoreCivic facility, we have contract monitors on site. In fact, we added additional staff a few years ago to that component of staffing for our CoreCivic partners. We have people, TDOC staff on site. Our TDOC medical director will be following these cases and the processes of testing as we were involved in this first round of testing. We will also be involved in the second round of testing where we test the other 3 CoreCivic facilities. So to answer your question, we will have state staff involved in that process, and my communications with CoreCivic has been very positive as far as they're cooperating 100% with what we're asking them to do in addition to the normal process of testing these inmates. So I don't anticipate any issues with the testing process or their cooperation with the state in our request.
Thank you, Commissioner. And Governor, my last question for you is that yesterday I asked you whether you were considering hazard pay for frontline workers, including correctional staff. You told me no. Based on the latest development, has your opinion changed?
No, we don't have any plans to include hazard pay in our workers, for our workers.
Governor.
Thank you.
Next, we'll go to Andy Scherer for the Times Free Press. Andy, your line is open.
Thank you. Hi, Governor. There are at least 2 DAs, district attorney generals in Tennessee, and my understanding is more, at least 2 beyond that, and possibly even more, that disagree with your executive orders and believe that they're unconstitutionally vague in some instances, and just have various issues with those. How do you respond to that? And the end result being that they're not carrying out anything. They don't plan on enforcing them. How do you respond to that? Do you think that there are problems with the executive orders, and what do you think about the DAs doing this?
Yeah, Andy, it's very clear that executive orders are constitutional, and that they're intended in this particular instance to provide for public safety and to protect Tennesseans and to make decisions that will ensure the health and safety of our citizens. That's why they've been made, and it's clear that they're constitutional.
What, I mean, do you think that? I mean, so they're saying that some of these are, that they're vague, and it just makes it difficult, and that it might be, particularly when it carries criminal penalties, and that they'd be fine if it were civil penalties, but of course that's not in their purview. But any thought to doing that? And on top of that, I guess, I mean, a lot of this is guidance as well. I mean, is there still a trigger for criminal penalties there, or in your view?
Well, I'll just say again that our executive orders have been clear, they've been legal, they've been constitutional, and they've been put in place to protect Tennessee citizens. And I'm confident of that, and I stand certain of that. That's why they're put in place, and we'll continue to only issue executive orders where necessary to make sure that our citizens are protected through this pandemic.
Thanks, sir.
Thank you.
That's all the time we have for questions today, Governor, if you'd like to make a closing statement.
Thanks again for joining us today. Much is happening in our state, but the most important thing that's happening is Tennesseans are doing what we've asked them to do. Businesses are doing what we've asked them to do. And because of that, we have great hope for where this state is headed, for our ability to keep our citizens safe and protected, and for their health to be protected, and for us to mitigate and continue to mitigate the spread of this virus that has made its way through our entire country and indeed across the world. But we have great hope as we continue our efforts to fight COVID-19, and as we continue our efforts to open the door to opening our economy so Tennesseans can get back to work, so they can begin to make a living for their families once again, and we can navigate our way through this crisis in a way that has outcomes that will benefit all Tennesseans. We so appreciate what each one of you are doing to make this possible. Continue to do your part and stay apart. Thank you.